introduction, if you're not already familiar with us, my name is Shannon Battle. I'm the Pharmacy Services Manager and primary point of contact for all things Vendor Advantage Network with IPC. And I'm here with my colleague, Samantha Pomeroy, Director of Pharmacy Services and Specialty Programs, and Kelly Stovall, our Vice President of Clinical Programs and Pharmacy Services. We also have our special guest, Hayden Goldman from Olympia Pharmaceuticals. So welcome all of you. I'm glad to have us all here today.
Yes, ma'am. Thank you for having me.
Absolutely. Well, we want to welcome all of our IPC viewers. Any of you have been here before or are new to the videos. We really want to encourage you to ask questions throughout, both clinical and otherwise. All of us will be looking at the Q&As and be able to answer them throughout the presentation today. And then at the end as well, we'll catch any that we hadn't before. If you did miss the last webinar, we went over some really great discounts that we had on compounded products for IPC offered by Olympia Pharmaceuticals and how you can grow this cash-based opportunity. So today will be much of the same, just expanding on some different specialties. Sam and Kelly, thank you guys for being here as always. What are you guys hearing from our members currently on how they're incorporating cash opportunities? These compounding opportunities are there, but maybe they don't know how to get started, or what great areas, just any information you already have and that would help stores out.
Sure. So, similarly to our last call with Olympia, every time I consult with a pharmacy, they're asking me, Sam, what's a opportunity that I can get involved in with not a huge cash, advancement up front, that will help my patients, my community. And this is just a great option. We partnered with Olympia for our pharmacies to be able to source these 503B products, and general wellness, erectile dysfunction, weight loss. And all of these categories are really on the rise. And so our last webinar, Hayden gave us some really great pointers with wellness and longevity, and weight loss, where to market those, what physicians' offices to look to. So I'm really looking forward to, focusing today on erectile dysfunction and some men's health options for our pharmacies to be able to source from Olympia. And this is just a really great option for not that much of a, an investment up front, and this is a great opportunity for our stores to be able to see if this is going to work in their pharmacy and their community, and what interest they're going to have in their area from their patients and physicians. So excited to be here to listen in.
Sam, that's well said. I think the other exciting thing about a product like this is these patients are already walking in your door, and this allows you to help them in a further way, because we know that with chronic conditions, ED does increase. Men with diabetes have a 50% higher risk of ED. So this is just another opportunity for you to increase that type of care for the patients that you have now as well.
Yeah, absolutely. Well, Hayden, let's jump right in. I'll let you get started on the slides and really let us know all you have to know about the men's health and these products.
Oh yeah, absolutely. Absolutely. So, really ED, this is kind of the progression we see with most patients, right? First line of treatment, maybe something over the counter that, who in the world knows what it's going to do. We have seen some success with L-arginine. It is a vasodilator, really allows, I would say those maybe with super mild early stages of ED might see some results just with L-arginine alone. Something interesting that we're seeing throughout, I would say, the industry are these telemedicine practices, the Blue Chews, the Row, Hims and Hers, rolling out easy, accessible sildenafil, tadalafil, whether that is a gummy, it's might be a tablet. But what this is allowing for are younger and younger patients to get their hands on sildenafil and tadalafil early, right? So over time, what we are seeing are more and more patients at a younger age struggling with ED because they might have built some sort of a tolerance to sildenafil and tadalafil much earlier than we've ever seen, previously or in the past. So the last line of treatment and those that have been struggling with ED for quite some time. Maybe the sildenafil and tadalafil just aren't doing the, quite the trick any longer. That's where we can go ahead and start, utilizing some form of trimix, whether that's a bimix just to get them started. Trimix, we have some really popular lower concentrate or strength trimix formulas, and then we also have quad mix. So what that also allows with these SKUs, and I think later on in the PowerPoint, we'll take a look at all the SKUs that we have to offer. It allows for patients to start again with like a bimix in early stages, and you will retain patients through, the various bimixes that we have. We have a ton of trimix formulas and then into quad mix. We see patients coming back time and time again over, the span of 30 years obtaining trimix, because once you start, all that patient's going to do is work their way through that formulary, and now you have phenomenal patient retention, right? Because they're going to continue coming back, and it allows you to steadily increase or pivot that formula as needed, just based on the results that they are seeing. So what is trimix? So trimix is a combination of papaverine, phentolamine, and atropine. These products work phenomenal together. It really works as vasodilators, locking in the blood vessels in the penis. Papaverine, it does a really great job, relaxes, the muscles in the penis to allow for erections to begin much easier, and retained as well, right? We could go ahead and go to the next slide. So why trimix? Trimix, there are multiple studies out there. I would say the main issue that we see is priapism. Keep in mind, we do have phenylephrine. Phenylephrine is a phenomenal reversal agent. We always provide phenylephrine free whenever a patient is first getting into trimix and it might be their first time utilizing it. We'll go ahead, throw in a free papaverine, or I'm sorry, a free phentolamine. Holy mackerel, I'm going all over the place. But
Phenylephrine. Phenylephrine.
Phenylephrine, the P's are killing me today. We'll throw in a free phenylephrine, and that's just there just in case, right? Maybe if they inject just a little too much on their first try, they always have that reversal. So that's always a good selling point, kind of ease the mind of the patient if they do have hesitancies, which trust me, I totally understand why they would be hesitant, but having that reversal always available is great. Another great thing about trimix, we have stability to show that it is good and has a beyond use date for 360 days. We don't run stability for 360 days on hardly any of our products. We've been doing trimix for a very long time. It's pretty much what we were kind of built on, or our foundation. And of course, our sterile SKUs have just grown from there, but trimix is like our bread and butter, no doubt. So you'll see there are studies here. So priapism extremely low. And for those that do have priapisms, you can offer the reversal. I would definitely consider, if you are purchasing trimix, it's just, okay, I need to order the phenylephrine as well. But yeah, great success there. This is a really interesting stat. So 92 to 100% response rate of those who did not respond to monotherapy. So those that were just taking a sildenafil tadalafil, you throw in alprazolam, which is one of the ingredients that is utilized in trimix, and boom, all of a sudden they are seeing results. So people do become very much stagnant, I would say, in the space of ED, where they just either don't want to go to the doctor to, talk about it and seek alternatives, or, they might be just hesitant to talk about it in general. And I think we see that across all lines of men's health. But it is a phenomenal way to kind of break through that barrier, right?
The support that you guys have for the pharmacies is amazing. I think it'll make it a lot easier to break some of those barriers.
Oh yeah, 100%. Our pharmacists have like borderline mastered everything when it comes to ED, speaking to these patients, redosing of Trimix, things of that nature. But you'll see like the onset of action is quicker than what you see with the oral products. That I believe one thing that is very interesting. So we can kind of put two and two together, alcohol and sex. There are no contraindications there, which is phenomenal. I think that is something you see across ED patients. But yeah, this is a fantastic product, and this is just comparing the two.
Hayden, you said that, and this was my experience too. Before coming to IPC, we offered Trimix, and it was one of our best sellers in our men's health category. And there was always, at least 3 refills on a Trimix because, like you said, they generally stay on this treatment because it is so successful. When a patient is starting out, or for any of our pharmacists that might be joining or listening to the recording of this, kind of just getting into this space, the patient starting out on this, do you recommend that the pharmacist order, the formulation that was prescribed plus the additional refills to have that in stock? Or do you see after the first initial formulation is given to the patient that there are adjustments and to what kind of wait to order those, second to third vials until, maybe adjustments need to be made?
That is a really great question. I would say it's safe to say always have your providers prescribe with refills. Maybe let's say that formula was not quite the fit. Don't refill that script, right? Hopefully go back to the urologist and, figure out or find a dose that works out well, right? What we usually say is to start, anywhere between 5 and 10 units. The like really sweet spot for a dose that does work and somebody that's been taking Trimix is around 25 units. As you continue taking Trimix, once you get over that kind of 25 unit mark is when we might need to consider a different dose, right? We want to keep the volume of the product being injected relatively low. So if a patient up front is like not getting the results, having to inject well over, 25 units, of course, that would be a tall tale sign. Let's get back with the urologist and let's figure out a dose that does fit the need for this patient, right? And we have some really good, I would say, formulas that most go with like upfront or first. And I think you'll see that on the next slide as well. Does that answer your question, Samantha?
Yes, yeah. I just was wanting to point out that I think that's a great option with Olympia, that you can just order one vial. So if you are just now getting into this space or just now offering this or sourcing this from Olympia, perhaps on that first prescription, order the one vial to make sure that that's the dose that your patient's going to need before you order those additional refills in.
Absolutely. And you know what, Shannon, now that I'm looking at the slide, I know what the next slide is. Let's go to the next slide and then let's go back to this slide. So as you can see at Olympia, we have 20 plus formulas, right? This is a lot to kind of take in. What are all these numbers meaning, like the different formula names? Trust me, I have no idea who in the world came up with these names for these formulas, but so be it. So we do have a lot, which is, I think, a pro, and I do think it is a con to a degree. There are pharmacies out there that are offering, 2 to 5 formulas of Trimix. That is not going to work. It's not going to work because your patient retention rates aren't going to be great. You're only offering limited options, and transparently, every patient's different, and I think it can be addressed in various ways, right? Now, up top, you see our Bimix BM3. That is a great option. For somebody with I would say mild ED, the T101, 105, and 106. That is usually where we start majority of our Trimix patients. Those are no ifs, ands, or buts, our best sellers, right? And then you make your way down, you'll see the various formulas do change in strength, but that is exactly how it's designed, right? Sure, we'll start a patient on T105 and they'll be on that for quite a few, years potentially before we might have to consider something like a SB4 or SB5. The SBs are really great as well. So with that in mind, yes, it can be a lot. And if you were to take this, and I would say from a marketing aspect and shopping this within your community at various urologist offices, they are going to know what Trimix is. We have not met a urologist that is like, oh, haven't tried that line of treatment. That is false. They very well know what Trimix is, and they should be somewhat oriented to it. So being able to go to a urologist office and have this sort of offering available to them is very, very much intriguing, right? Now, in terms of it, a pharmacy getting into it, well, where in the world do I start? Holy mackerel, there are 20 formulas here. And, that is where I would go to the slide previous that we were just on, right? So with that in mind, what we have done, and we've actually partnered with a telemedicine practice, and I'll drop the name Henry Meds. They're phenomenal. They were really the first movers when it came to GLP-1s. And lo and behold, they're the first movers when it has come to Trimix as well. So what we did was really pare down our formulary to just a few different SKUs, right? And I think can very much easily be replicated at the level of each independent pharmacy, rather than having, 20 plus SKUs that you have to keep up with, and maybe you might have, let's say it's very successful for you, rather than keeping inventory of all of these, right, all 20, let's narrow it down and let's just, maybe shelf the few that you are seeing, prescribe more frequently, right? Now, the phenomenal thing is, yeah, we're only going to shelf, let's say, BM3, T105, and SB4. Those are like our three go-tos, right? But if you have patients with needs that are outside of that, just know we have next business day turnaround time, and you are going to get it by the next business day. Just order those one-offs as needed, right? I think that is a big benefit. The other big benefit being able to actually shelve these, the 360-day beyond use date from data compound, that is a huge plus as well. It doesn't necessarily have to fly off your shelves, but if you have a urologist that is interested, it only makes sense to keep these products at your pharmacy and have them readily available for their patients, same day pickup. I think that is definitely intriguing.
Hayden, we have a question from
Yes.
Rod. Will you customize formulations to one urologist according to what that urologist writes?
That is a very great question. So it was something that we did do in the past. We were, tiny pharmacy when we were doing that. But no, at this point we wouldn't. Again, these are 503B products, so products produced out of the bee. To get any sterile product through R&D, MDMB, and stability testing, that's about a 6 to 8 month process. But with that in mind, understanding what dose is needed, that's also a plus, right? Whatever dose is being written for, or certain formula, we'll have comparable or comparable formulas to that within our 20. So there are alternatives. I know some urologists are just dead set on a wicked crazy dose that lo and behold is not within our 20. You can always, I would say, consult with the urologist, right? See what would fit the mold.
You have these certain ones that, of course, pharmacies are going to be using more often. They're probably the ones that they're going to want to talk to their urologist about. Do you guys have marketing kind of already put together that they could present local offices?
We do. If we want to go to the not next slide, but the slide after, we can go to the patient resources. So we have a ton of resources available for patients. We have a dosing guide as well. That's phenomenal. I mean, in all honesty, I think the biggest marketing push here and the biggest benefit would be the number of SKUs that we have available. So, I mean, simply going to a urologist office and being able to show them all the various formulas you can offer, I believe markets itself to a degree, because a urologist, they know the benefit there, right? So that's my take on it. that you don't have to know it that well. Again, having that many formulas at your disposal that you can have at your facility by the very next business day is a huge, feather in the hat per se, right? And that's why I believe it really does market itself. Now, there are folks out there and clinicians that are or kind of shy away from the educational piece of it, right? That's why we have seen pretty much all other product lines flourish in telemedicine practice, right? Trimix is going to be the last one to be taken, but once folks do start offering it virtually or via, virtual health, it is going to take off because their patient retention is going to be so much better than, any other product line or service line that you're offering. It's going to be the patient education barrier, I think, when it comes to telemedicine, and we have a ton of resources to help with that. But that is my take in all honesty, Shannon, to kind of your question there. I think it is a big educational piece.
Yeah, it's definitely helpful to have that support from you guys as
Mhm.
well. Cheers.
No doubt, no doubt. And our pharmacists, they're available. They are the ones that make up, like the Trimix injection guide there that you see. We'll send that in every like patient prescription we send out. I'm pretty sure we provide at least one copy of that when sending it as an office use order or out of the 503B without a patient prescription. But yeah, phenomenal resources put together by them. They are always on the phone. So if there are any questions about dosing or, maybe redosing, that they are a phenomenal resource. And in all honesty, majority of the calls we get in, it's not necessarily the dose or the formula. It's truly how the patient is injecting as well. So being able to provide your patient with a, URL or a QR code, whatever you might want, you'd be able to easily plug in that Trimix injection tutorial, and that should be very beneficial for patients as well.
Alrighty.
And last but not least, marketing plugged this in, but I am really excited about it. This does not help with ED, but it is a phenomenal product, one that we're going to see, have great success. Liquid Samorelin coming what I would call late fall of 2025, around November. Again, it's one that we talked about in the last webinar. Another product that we expect to do very well towards the end of this year, beginning of next.
So you'll let us know as soon as this is available, Hayden, for our members, because we've gotten several questions about this. I think this is going to be an amazing, offer within independent pharmacy.
100%, because I'm like scratching and clawing. Liquid Samorelin was actually a suggestion that I made probably towards the tail end of last year, beginning of this year, and seeing it actually come to life is pretty exciting.
Good
So
time to
what's the beyond use date of the liquid Samorelin? Do you have that yet?
No, we have not sent it off for stability testing. Transparently, we are going to want to get this out to market as soon as possible. So it's likely that it'll launch with a slightly shorter beyond use date
Sure.
because,
Okay.
stability, that just takes time, right? We will end up running it through 360 days. I mean, that we won't get there until the end of next year, I believe, but I think it'll likely launch with 90 is what we're hoping. I think we are pretty eager for it, so it might even launch with 60, but we traditionally don't launch with anything less than 90. And why Olympia? So the discrete packaging, I believe that might be one. They put it on there. Not every day I see our packaging transparently. Overnight shipping, I think that is overnight shipping, same day processing has got to be one thing that sets Olympia apart. No ifs, ands, or buts about it. I mean, anytime you get an order in with us prior to 12 p.m. Eastern Standard Time, I'd say Monday through Thursday. Now that GLP-1s are gone and Mondays aren't such a bear, we are getting product out same day. So that is huge. And then pharmacists, our team of pharmacists are phenomenal. Again, that is something not a whole lot of 503Bs have at their disposal. We have a team of 5 or 6 clinical pharmacists that man the phones, ready to answer questions, concerns that you might get from your clinicians that you might be working with or patients alike. Marketing materials. We have added an individual on our marketing team, and they actually have an email and field request for any such marketing material that you might want specifically or, potentially altered. They're more than happy to work with you. And then last but not least, our quality department. I think the last webinar we were mid FDA audit. We are done with the FDA audit. And the 483 we just got or did get was phenomenal. And full transparency, it was our best FDA audit that we've had in quite some time. Even though the previous ones weren't terrible, this one is stellar. I think they were 3 little minor items that they picked up on. So we're really excited, and it's a true testament to our quality team. We just became NABP certified out of our 503B as of yesterday. So really excited about that. That was a long process. So between next day shipping, I would say clinical pharmacist, our customer service, I know my team, they are responsive because they report to me. And if they aren't, we're going to have a conversation. So between that and our quality, I mean, it is a true testament to how phenomenal this organization is.
Well, thank you again, Hayden. It's great every time. You guys have so much information that our stores are really looking for. As a viewer, if you haven't already signed up with Olympia, there is a QR code there on the screen. It'll take you right to their landing page on our website. Alternatively, if you go to IPC's website, you can go to the vendor section, and they're all listed in alphabetical order. There's a short contact form there that you can submit, not just to order, but to get set up so you can view pricing and everything that they have. And really just get started and look around, even if you're not quite ready to order. The team is really responsible and ready to reach out to you guys. There's full catalogs. You can explore all of the things they have, educational materials included. So, Hayden, again, if we haven't mentioned it to you guys, the discount for IPC members is anywhere from 25 to 35%. There are a few items. I think, Hayden, you said last time on our call that there's a few that may be even a little bit lower than what we started, or a better discount now. So that's
yeah, I believe so. Got to be on. I don't have my master spreadsheet up right now, but yes, that is true.
Yeah. Well, Olympia is one of the 45 vendors that our department has brought on to help all of our stores increase profits and bottom line. So one of the best that we've had recently, and we really love this partnership. So again, I appreciate you being on here. Kelly and Sam, anything to add there?
No, I was just going to say, Hayden, thank you to you and your team for being so responsive to all of our members that have reached out to you. I mean, they get an immediate response. It's easy for them to get set up. You answer questions. And so, this is a really clinical space. And, we appreciate the information from your clinical pharmacist on staff answering questions that our pharmacists might have in their independent pharmacy to get started in this area if they are not. So thank you for your time.
Absolutely.
Thank you again, everyone. This will be a recording and it'll be sent out via email. Reach out to us anytime with the further questions. You guys have a great rest of your week.
Thank you.
Thank you all.
Thank you.